Welcome back to the Neuro Health broadcast. I'm your host, Dr. Joe, and today we are joined by Dr. Suzanne Pikula. Today we're talking about SOT, or Sacro-Occipital Technique, as well as alternatives within the profession of chiropractic. So a lot of you may be familiar with kind of your traditional chiropractic adjustment, but many of you may not know that there are many ways to address someone chiropractically. So Dr. Suzanne is going to speak with us on what she does, how working with kind of special cases sometimes requires special adjusting techniques. Dr. Pikula is a Columbus, Ohio native, graduating from Wilmington College with a bachelor's degree in biology. She's an avid equestrian and athlete as a young adult. She was fascinated by anatomy and the biomechanics of the human body. It was then that she was introduced to Integrative Spinal Analysis, which she now combines with Sacro-Occipital Technique and multiple other modalities which have become her focus. After 4 years of rigorous study at Life University, Dr. Suzanne moved back to her hometown of Columbus, and now she is committed to her care to provide comprehensive solutions to better help her patients find help, hope, and relief for their chronic health problems. So I hope you enjoy this episode as much as I did. And if you're curious about, other techniques within chiropractic, this is going to be a great episode for you. So after a quick announcement, Dr. Suzanne Pikula. This podcast is brought to you by Delta Neuro Health, located in Columbus, Ohio, where non-invasive, personalized care is revolutionizing the way we approach complex neurological issues. With cutting-edge techniques in functional neurology, functional medicine, and chiropractic care, we're leading the way in managing conditions like concussion, dizziness, brain fog, anxiety, POTS, attention, and more. To learn more, visit our website at deltaneurohealth.com. Welcome back to the Neuro Health broadcast. I'm your host, Dr. Kappas, and I'm here today with Dr. Suzanne Pikula. Thank you for joining us today.
Thanks for having me.
Of course. So, Dr. Pikula, can you tell us a little bit about yourself and what it is you do?
Sure. So I practice in Columbus, Ohio, more technically, I guess, Dublin. And I'm a part of a health collaborative. We have a couple massage therapists, a counselor, heart and math practitioner, and the chiropractor. And I practice with a few different things. I got into chiropractic because my horse fell on me when I was 16, and I got to visit the chiropractor, and I had a concussion, and that restored movement back in my neck. But I went to chiropractic school because I had been working in the pharmacy for a few years after getting my biology degree, and kind of got I was like, there's got to be something more than giving people medications to feel better. So I went to chiropractic school, and the only technique that I've been really exposed to was kind of your regular chiropractic adjustment, a lot of high velocity maneuvers. And I have something called an Arnold-Chiari, so I cannot have regular chiropractic maneuvers. What that means is, you have your skull, and for your readers or your listeners, sorry, your brain herniates a little bit into that skull, out through the foramen magnum, and high velocity amplitude movers are not safe for my body. I was introduced to the one practitioner in school that did Sacro-Occipital Technique, and he adjusted my atlas by my foot, and I was hooked. I was like, I don't know what you just did, but that was really cool. And he said, if you want to go learn this, you need to start now, because they don't teach it till like your last trimester before school is done.
Right.
And I fell in love with it because the body's so interconnected. We're more than like back pain, more than neck pain. I mean, the brain's kind of the engineer for everything. But the technique was made up by an osteopath who is an engineer who's also a chiropractor. And he was like, one thing's going wrong, but it can have 16 different things that's actually causing it. And one of the things I liked about it is it has indicators. Where in like regular chiropractic, it's kind of like what doesn't move, then we push it back in. But this is like, if you have back pain, maybe it's a cranial bone that's out of alignment, or maybe you have a visceral component. This technique kind of brings together visceral, cranial, extremity, spine, pelvis, all that jazz, and is trying to figure out like what is the kind of root cause of everything rather than what hurts.
Mm-hmm. Right.
Um, and it also brings in that, cranial sacral fluid, the cranial sacral motion, the primal respiratory motion. Your brain basically coils and uncoils each 12 times a minute. And the skull bones expand, release, and you release that CSF fluid goes up and down the spine. And that's kind of controls everything.
Mm-hmm.
And so
Yeah.
I fell in love with that because I was like, you can touch somebody like with a teeny tiny touch and have a profound effect in the body. You don't have to use a sledgehammer. You can use a feather.
Right. And I think it's very important for people to be aware of just the fact that chiropractic is not a black and white thing.
Hmm.
Like, there's not one way to adjust. And for special cases like yourself, you mentioned you had the Chiari malformation. Cases like that are not going to respond well to the high amplitude forceful adjustments that maybe people are seeing on TikTok these days. So it's a wonderful thing that there are other ways, and I love SOT, and I think it has some really powerful effects and consequences. While it doesn't seem like it's like an aggressive thing, but it still creates these really massive results, which is fantastic, I think. And so uh, you were kind of talking a little bit about what it was and the idea behind it, but um, how might somebody know that they're in a SOT practitioner's office?
Well, often I think SOT is really known for blocking. A lot of
Mhm.
times people would say, "Oh, my chiropractor used blocks and my sciatica got out of control." And they'll use, these triangular shaped blocks to balance the pelvis, but that's like less than 1% of the technique. It's kind of rebalance the cranium and the sacrum. So they'll often, SOT chiropractors use things called indicators to
Mhm.
tell them the part that they're hitting is the correct part. Like if somebody comes in with low back pain, they're going to be looking at the back, but more importantly, they're going to be testing the psoas and the cranium and things like that. So they're going to be doing basically muscle testing while they're checking the part that needs to be addressed. And then they'll go back and recheck it to make sure that it actually made the correction that they're looking for.
Mhm. And with that, what goes into, I guess, the initial analysis that you might be using on a patient?
So it kind of depends on which way you're going about it. We often use something called mind language. And you're having the patient do certain movements, usually while they're standing. Most SOT practitioners look for three categories of dysfunction. I think there were originally 10, but now there are about three. And a lot of patients are, category one is kind of your classical brain-based dura mater pushing around the spinal cord. So it's like people with headaches or Chiari or sinus infections. Um, and then your category two is your classic like SI joint instability. And then your category three is, that's when the whole system's blown out. That's through the discogenic system. That's your classic sciatica, low back is locked up pain. Now, most people are a combination of one or two or three categories. It's never just black and white. It's usually one or, it's between the two. And that's kind of the beauty of the technique is that you're able to suss out what the real issue is rather than what the body's screaming. Because a
Hmm.
lot of times, at least in my viewpoint, what hurts is actually not the problem for most people.
Hmm.
It's somewhere else in the body.
Okay. Can you dive a little deeper into that concept there? Because I know earlier you mentioned the first thing that hooked you onto SOT was somebody adjusted your ankle, and all of a sudden your atlas actually went back into place. Um, so with that in mind, how might why is it important not to always go towards the point of pain in a patient's condition?
So, you think about we have something called the pain gate theory, right?
Mhm.
So you get stimulus, 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 and oh, finally it's pain, right? But the body kind of works as the things that are most important are going to hurt the most. I mean, when we have abdominal pain, you can't tell whether it's the heart or the abdomen or the head, or it's very non-specific. People who have heart pain or brain pain, they're having a stroke. You pretty much know that's what's going on. But
Mhm.
with the body, you can have back pain, but a lot of people, it's actually a front issue happening. The front always sacrifices the back. If you're thinking about when you get hit, you're kind of like that, right? We never put our back out or front out to get hit. And you'll often through the body kind of sits like the body has a fascial system. And I always explain this to people that we have fascia, muscle, bone, and then our organs sit in fascia. They writhe and contract, and that's how they even move. But you can have pain in your back that's actually your stomach or your liver. Those are in the viscerosomatic regions. You can have back pain that's actually the psoas or the intestines, getting contracted and they're getting stuck. You can have, there's a paper put out by the Osteopathic Association of chronic neck pain solved from adjusting the stomach. A lot of upper jaw, a lot of this stuff comes from the back and vice versa. You can have somebody who had like back surgery and adjust their jaw and it helps their back if they have pain afterwards. So it's kind of like um, I don't chase pain because if you chase pain, you're kind of chasing symptoms. You're kind of
Mhm.
getting that immediate release, but the body's too complicated to be like, okay, we're one and done. Usually it has like a whole bunch of other stuff going on that allow the body to get to that point of dysfunction.
Do you find that as an SOT practitioner that the three category system is able to encompass every patient? And if not, what do you do then if someone maybe doesn't fall into one of those categories?
I find that SOT encompasses a lot of patients, but like I said, not everybody's black and white. Most people are
Mhm.
shades of gray. So I call on other techniques. Being a zebra myself, I wanted to create a wide tool belt. So I learned a lot of different things and started putting them together. And I was very fortunate in grad school to mentor with a chiropractor who's also a massage therapist. Because then she started to teach me the myofascial meridians and putting that together. And I do a lot within the fascial lines of releasing, like, I tell people, your tongue is actually connected to your low back, and you can release the tongue to release low back pain. So if SOT doesn't solve it, then I go into these other techniques, mainly soft tissue, to start figuring out where the body's having struggles. Or, if I have a patient who sometimes folks are so sympathetically driven they can't be touched.
Mhm.
So we'll kind of back off and go into more brain-based techniques or cerebral spinal fluid techniques, or even eye conjugate reflex techniques to kind of work off the body and allow the body to accept what we're doing.
Mhm. With a structured technique like SOT, or at least something where you have a framework, do you find that adding in these different elements that you mentioned, is that more of typically a synergistic help, or do they ever contradict one another? Or yeah.
Yeah, you're good. I found that it's more synergistic because I'm tailoring it kind of what that patient needs that day.
Hmm.
So I can't say that they contraindicate each other. Like one technique, obviously you can't use like Thompson for some folks if they
Hmm.
have osteoporosis. or you have to be very careful. Or, but in general, they work very well together because if I get stuck or hung up, I can kind of lean into another part of the toolbox to use that.
Mhm. One of my favorite stories with SOT is I guess a personal story, is I had a patient who suffered a spinal concussion, and he was developing a very, I guess, liquid, or very blanking on the opposite of viscous, but very runny nose. It wasn't
Hmm.
snot, but they could never find the leak, the
Yeah.
CSF leak. Um, and so he was getting really severe pressure headaches. And we started doing SOT with him because we know that that affects the cerebrospinal fluid and the flow. So we would implement that technique, and it really helped his pressure headaches, which that was the first thing that would touch them. So piggybacking off of that story, what are some of the patients or the conditions that you find SOT is the most effective for?
Um, so usually folks that have chronic issues, I've had patients with CSF leaks.
Hmm.
I had a patient with an Arnold Chiari type 3 that had
Hmm.
had the surgery and she had no pain relief. And so we did craniopathy and rebalanced the pressure, and that took the pain away. Craniopathy works really well for Chiari. The SOT works really well for folks who have like hypermobility or EDS or
Hmm.
folks that have POTS because their nervous system's already running so high that a lot of input, their body can't take it, the brain can't take it. Um, or folks that like have more than just, an easy or not easy, but like a simple case of like musculoskeletal pain. It's usually somebody who's looking way outside the box because they're trying things, but they've got an emotional component or they've got a physical component. SOT is very safe for people who've had like surgery. There's almost no contraindications for that because it's not forceful. So I have a number of folks who've had low back surgery who still have pain.
Hmm.
And so we use SOT and it works really, really well.
Hmm.
People who have like chronic headaches or TMJ, because that's a specialization within SOT, respond extremely well to it.
Hmm. Is SOT generally considered to be safe for all ages? Are there any contraindications?
No, I think that like one of the only contraindications like is if somebody has like a hydrocephalus or a shunt, that's probably when I would not do SOT. But my youngest patients will be, sometimes just born. And I have my oldest patients 102.
Hmm.
So because it's so gentle and we're working, it's such a soft kind of, it's not so forceful. I haven't run into any contraindications for age groups. It generally is safe across all ages.
Hmm. That's great. Um, a concept you had mentioned earlier was that of fascia. You kind of
Hmm.
talked about the different connective tissue and muscular tissue. Um, with fascia, and I know you also do a lot of different myofascial work to complement your SOT technique. Um, how does the fascial system interplay in the body? And I mean, this is going to go hand in hand with what we've been talking about, but yeah.
So your fascia system, it's kind of neat because they're just discovering about it, and it basically kind of has its own nervous system. It extends like basically a sheeting in the body. So the Myers lines were created. There's the myofascial lines, and they've discovered that there are like 8 lines of these fascia that connects from head to toe. You've got your deep frontal line, back lines, spiral lines, lateral lines, and things like that. And they figured out that it affects your stability, resistance, flexibility, elasticity, and your posture. They kind of create this fluidity within the body, and folks Um, if they have a disruption in the fascial system, people sit forward all the time, they drive forward, they have these chronic posture problems, and it will create a disruption in the fascia. The fascia should be sticky on the body and move, but a lot of people it locks down like concrete. So if you take somebody who's having pain and you do more of a forceful adjustment, if their body's not ready to give it back, it'll rebound.
Mm-hmm.
The bones may go into place, but eventually they go right back out because the body itself is not ready to release it.
Mm-hmm.
So that's what made me dive into more of the fascial work and looking into those interconnections because I find, especially with my hypermobile folks, they have a lot of cranial issues. Most of them TMJ, chronic sinus issues, dental issues. They'll often have digestive issues. And you can rebalance the pelvis, but if you don't rebalance the head with the pelvis, then the pelvis never stays.
Mm-hmm.
And a lot of them have pelvic floor issues along with like cranial issues. And if you don't address this and this, then their body can't stabilize.
Mm-hmm.
And
The way,
it's go ahead.
oh, I was gonna say the way you talk about SOT is very reminiscent of how I think of Tai Chi,
Yeah.
and it's very much just kind of like this very fluid thing that you're working with the body on, rather than maybe a high velocity adjustment, which can be very valid, but maybe that's more like a karate
Yeah,
move
karate chop.
rather than a Tai Chi move, right?
Well, I think about, we all have our stressors. The brain is continually taking things in and modifying and doing what it needs to do to the outside world. And everybody's kind of under chronic stress, life stress, relationships, work stress, all that jazz. And one of my favorite sayings is like, if your body or your brain does not feel safe, your body will not receive the treatment. You can have the most well-intentioned treatment, but if the body does not feel safe, it will not receive it.
Hmm.
So I think it's, kind of our space as practitioners to help our patients kind of reach that homeostatic safety
Hmm.
while we're doing work with them.
Hmm. And I think also the work that you're doing in your chiropractic practice and your SOT practice is uh, if our bodies are getting tensed up, and
Mhm,
then you are able to work with them in a way that is kind of easier to accept or kind of less abrupt, you know,
mhm,
that may be able to send kind of a reflexive signal to the brain saying like, okay, it's okay to release.
mhm.
Yeah. Um, Given the state of healthcare and kind of the current model that patients are used to seeing right now, it sounds like you provide a very individualistic approach. Why do you think that's so important for getting the patients you see better?
So it's interesting kind of asking this question because my dad went in the hospital and I went as his advocate. And he had multilobar pneumonia. And the doctors were not able to isolate the bacteria that was causing it. And I brought up the point. I said, you know what? This man's had a 45-year exposure to mold, and he just cleaned out his office, and 2 weeks later, he's got pneumonia.
Mhm,
I said, I know we're looking for bacteria, but can we look for fungus too?
mhm,
And it was interesting the response I got because they said, oh, well, statistically, it's not probable. He doesn't have this. He doesn't have this. He's not, we have to look at horses, not zebras. And I said, for me, my whole practice is zebras. And we tend in healthcare look for patterns. We look for statistics. We look for, you have these 6 symptoms, you're this. You have this 6 symptoms, you're this. But the problem is that puts people in boxes. And people don't exist in boxes. We don't exist in black and white. We exist in gray. And a person can have these 3 symptoms, these 2 symptoms, this one symptom, and this. And I think our practitioners, need to be able to put it together, right? Because that creates a whole person. And we learn things in textbook, right? But nobody's textbook. And I can have a person come in with sciatica who's seen, most of my patients have already seen other practitioners. They're already, looking, and they get to me because they're like, oh, you're really outside the box. This is different. But it's because they've already been kind of typed and they can't figure it out. Or they're not putting all the pieces together of the whole person. And I think we kind of miss that in our current healthcare system. And sometimes even in the alternative systems, because it's the way we're taught, but it's not the way that things actually are.
Hmm. No, that's a good point. Um, so one of the zebras that you had mentioned earlier that you see respond very favorably with SOT is pot. Many people have started to experience it since COVID, especially, but it predates that, of course. It's just gaining a lot more traction, so we tend to see it a lot more. Um, Seeing those patients in your practice, how do they respond to SOT, maybe compared to a more forceful adjustment?
So my folks with POTS, again, try to be a little more sometimes they're more on the hypermobile spectrum too. It's
Hmm.
kind of like a triad of things. There are people with POTS from long COVID, but sometimes these things don't exist by themselves.
Hmm.
But those folks tend to not respond very favorably to more forceful adjustments. Usually it kind
Hmm.
of throws their nervous system way out of balance. Sometimes they get really dizzy, or they vomit, or they get sick, um, or they don't have a favorable response. It seems to be like it's too much because in a POTS system, um, as a person who has POTS themselves, it's kind of this balance, and it's a very careful balance. And it requires different things to get the brain to calm down, because the brain's having a hard time controlling everything all at once.
Hmm.
And, I find that with POTS, it requires a more less is more approach. And I'm sure that you have that in your field too, trying to regulate the brain and getting it to work at a much softer rhythm.
Hmm. Yeah, and I think what you do is perfect to help aid in POTS recovery. I mean, when you look at POTS, it's really under the umbrella of dysautonomia, right? And what is that? That is the dysregulation of the autonomic nervous system. So your fight or flight or your rest and digest are really at war with each other, and they're not. That system typically is not working efficiently. So, and typically the sympathetic tends to take over, which we see a lot of anxiety and gut issues as a result, because people are more so in this fight or flight. But I think what you're doing in your practice is you're really helping people to enter that parasympathetic, that rest and digest, in a very like, um, I guess, non-aggressive way, right? Just a very like an easing your way into it. You know, there's not a quick adjustment like we've talked about. There's not such a forceful thing that could either upregulate someone's sympathetic nervous system or just really overwhelm their metabolic capacity to handle that much neurologic stimulation. Because at the end of the day, an adjustment is going to be a neurologic intervention. So doing it in a way that is appropriate for that patient is crucial.
I think there's something to be said, and I'm sure you see it in your field too. We tend to associate big treatments with big results. And we tend to think about, we tend to like not realize that soft and steady, or slower, or more subtle can be just as powerful as a punch.
Mhm.
Sometimes more so. It depends on the patient. But I think that that's something into consideration that we have to take into, especially with POTS, because, or long COVID, you're getting massive brain inflammation.
Mhm.
So the brain requires, I think, more subtlety to calm
Mhm.
down.
Right. No, exactly. Do you find that in your practice you need to support supplementally or dietarily, or are you mostly focused on uh, body aspect?
I think it depends on the person's goals.
Hmm.
So A lot of folks with POTS or some other things, we talk about how the effects of toxins around them inflame their brains, and what they would like to do in their life because they're easy things you can do. They're easy ways that you can adopt your diet. If they need, my preference is to get their diet, their supplemental needs through diet. But if they need supplements, like cod liver oil is really hard to get. Uh, you have to eat a lot of fish. But things like that, then I will move into supplements.
Yeah, that makes sense. Yeah, and I think our general approach as chiropractors is we tend to be a little more conservative, and we don't want to become kind of supplement pushers.
Yes.
So a lot of times less is more when meeting the patient where they're at.
Hmm.
Um, can you talk? I know we had mentioned the uh, the stimulation that is supplied to the brain as a result of an adjustment and kind of the maybe variable spectrum with different types of adjustments. Can you speak to that reflexive system and how the adjustment is actually a neurological intervention?
Well, I think about, your brain receives everything that you put in it, right? So when you get an adjustment, it changes the signal to your brain right then. If you're doing a more forceful adjustment, you're going to get a lot more input.
Mhm.
If you're going softer, it's going to be more of a flow. If you're doing, craniopathy, you're literally changing the CSF fluid. And CSF fluid is like, it has a lymphatic function, it's got detox function, it's got nourishing function, it does all the things. So it's kind of changing a way in how your brain's receiving that adjustment, depending on how you put it through. I'm sure in your line of work, the brain receives the adjustment in an even different type of way. But I think it's just kind of nerve impulse as well as like in my world, changing the CSF fluid and literally changing the food source into the brain.
Mhm. Exactly. Yep, because we know that the brain needs three main things to survive, and we'll talk about this a lot on the podcast, but needs glucose, oxygen, and then stimulation.
Hmm.
So that's where chiropractic can come in, as well as a lot of other things. You know, the fascial work you do, that's all going to be stimulatory to the brain or improving that body-brain reflexive connection. So all fantastic stuff. Dr. Pikula, we are running short on time, but I wanted to make sure to give you enough time to tell our audience a little bit about how they might be able to find you, where they can find you, things like that.
Sure. Um, well, we are on Instagram through Balance Chiropractic Ohio. We're on Facebook. We're on a little bit on TikTok as Dr. Pikula. Um, but we are kind of out in the community. We do have events through the center and through our nonprofit for patient advocacy and empowerment. So they can find us on the internet at balancechiropracticohio.com. But we're also, like I said, we're in Dublin between Bethel and Henderson, and as far as renewal. So,
And what kind of parting advice would you give to a patient who might be used to traditional chiropractic care? Maybe it hasn't been working for them, or maybe someone who's been to a chiropractor in the past and it just wasn't for them because of whatever reason. What might you say to them to help them kind of put their guard down and check you out or check SOT out as a nice alternative?
I tell folks that they know their body better than anybody. And if their body will always tell them. If something's not working, your body will say that. Adjustment shouldn't hurt. I mean, it shouldn't cause more pain. It should, I think it can have a momentary bite, but like you should be feeling better. And if you're not getting results, it doesn't mean it's a bad practitioner. It may not be the right practitioner for you. We meet people in our life that we resonate with and that help us along our journey. And sometimes we get so far and then we need to switch and look outside the box.
Mhm. Yeah, and we started this podcast. We said that chiropractic is not black and white, and it's very much a spectrum. So if you can find what resonates with you along that spectrum. Go for that, because if one thing didn't work for you, chances are something else will. So just like anything in medicine, you just kind of have to keep trying and keep looking, because it's never a one size fits all.
And never stop looking for your answers.
Hmm. Yep. Yep. There's always hope.
Mhm.
But Doc, thank you for coming on the podcast today and for sharing your knowledge and wisdom surrounding SOT and patient care in general. This was invaluable, and I know our patients are going to, or sorry, our listeners are going to really appreciate this.
Thank you.
All right, take care.